Executive Director of Strategies to Empower People. We provide supported living, independent living, employment and day services. I also sit on the board of the California Community Living Network that represents supported living, independent living, employment, personal assistance, and respite care. These are all in-person services. So I'm going to really focus my comments on the direct support professionals and three focus areas. The triumphs and the challenges is first. When the pandemic began, California support programs were already understaffed. In-person support work is complicated, work that requires dedicated, trained personnel, but their work is undervalued and has always been underpaid by the state, making it difficult already to attract, recruit, and retain adequate staffing. The pandemic only magnified this problem. When the shelter-in-place order occurred, traditional day programs and day services were forced to close, and many moved to some form of remote or virtual services. That meant those receiving services were spending almost all of their time in isolation, and the need for in-person direct support professionals increased as they now needed to cover those day program hours as well. But the available workforce was decreasing. Most of our staff are women, they're single mothers, ethnically diverse, and like working women across the country, they suddenly had the additional responsibility of homeschooling their children and caring for their own parents and loved ones. There were men who also had to make these sacrifices. Many of our staff have had to leave the workforce to take on these additional responsibilities of homeschooling and childcare, and this has exacerbated the already existing staffing crisis. Another layer of uncertainty for staffing was directly related to COVID-19. When a staff was exposed or tested positive, they would enter a 14-day quarantine. When you were already understaffed, this was not only an added stressor to the provider, but the person supported, because were they exposed, and also they had instability in staffing. Additionally, there was the unfunded mandate for providers of the 80-hour COVID sick time pay enacted by California. As service providers, the biggest questions we had were, would our essential workforce continue to show up to work during this deadly pandemic? What would happen if they didn't show up? What if those receiving services were left home alone? How would we provide the necessary training for them to become infection control experts? Could we secure the PPE? Could we secure sanitation supplies? But just like emergency room doctors, nurses, firefighters, and police officers, our staff did show up because they knew they could be the difference between life and death for their clients. Not only did they show up, they became the backbone of the response to this public health crisis. Many have worked excessive overtime hours due to this staffing shortage. The direct support professionals have been the hidden workforce. They did not get the recognition of the healthcare professionals or even grocery store clerks, but what they did and what they continue to do has been invaluable. I think it's critically important as we're talking about this pandemic that we talk about the direct support professionals. I want to introduce you to La Chanel. La Chanel is a direct support professional since 2015. She works with Dom. This January, Dom was diagnosed with COVID-19. When he was taken by EMTs to the hospital did not want to admit Dom because of his complex behaviors, even though his blood ox level was at 86%. He was sent home. La Chanel made the choice at that time that she was going to be the primary caretaker for Dom. She stayed with him for 18 days. She left her fiance, her elderly in-laws who'd moved in during the pandemic. She left the children at home to stay with Dom because she knew if she did not stay there, that Dom may not survive COVID-19. This is a picture of Dom. I really want to show this. This is Dom in a lazy boy chair that's a vibrating chair. This vibrating chair, who knew that a massage chair would be a really critical component to COVID-19, because he could sit up and it kept his lungs clear. She made sure he had that chair. She made sure he was in the chair. She only slept when he slept. She was awake all that time. I remember she texted me and she said, you know what, Dom's feeling better because he hit me today. So we know that Dom was feeling better. This is La Chanel's commitment, but it wasn't just La Chanel making this commitment. These were direct support professionals across California. These direct support professionals became entertainers, teachers, nurses, counselors, communication facilitators, and tech support in their client's home. They have kept people out of the hospital by keeping them safe at home, supporting them effectively when they did become ill, sometimes at a great sacrifice to themselves. By all of their efforts, we know that people with intellectual and developmental disabilities, their lives were saved because of the work of these direct support professionals. We really appreciate that DDS made available in January of 2021. We wish it had happened sooner, but the isolation rate, because La Chanel was able to get a competitive wage while she was there with Dom. Now, our only hope is that competitive wage would become a more permanent wage for someone like La Chanel. How do we maintain quality services is a question we're being asked. Well, we professionalize the workforce. This workforce, we call them direct support professionals, but we don't pay them professional wages. We need to pay these direct support professionals a competitive wage. Even though our staff providing life-sustaining care, the state's wage rate is embarrassingly low, often near minimum wage, or minimum wage for many instances. Supporting and educating the workforce around vaccines and its safety is going to be another critical component as we move forward. Number 3, we must implement long-term solutions that emphasize equity and access and achieve quality outcomes. Accountability. We have to align our resources with measurable quality outcomes. CCLN is proud of the introduction of AB 813 by Assemblymember Mullen. It's a pilot project to measure quality outcomes. We think that's a critical component. I agree with everyone else. You cannot leave this 8.2 sunsetting. Many providers have given those as bonuses, or they've used that to recruit staff. Could you imagine we end up having to cut wages after everything these direct support professionals have done? We also need the local minimum wage funded. This has been an ongoing conversation. We appreciate it still happening. But I also really want to end with this really important point for me as a provider who does supported living services. We cannot make isolation a habit. Our community has fought against isolation for 30 years. The developmental centers are closed. As we move towards this new normal, we must stay committed to supporting a person's chosen way of life and having full inclusion in the community. So I want to thank you for your time. Those are my comments. I talked really fast because I was told to, so there you go.
Thank you, ma'am. Next, we have Judy Mark, President of Disability Voices United.
Thank you, Dr. Aramala and committee members. I'm Judy Mark. I'm a proud mom of Joshua, who is 24 and has autism. I'm also the president of Disability Voices